Today we will be talking about high emotional stress regarding social workers and therapists. First, I want to talk about burnout. Burnout is when somebody becomes quite literally burned out from the work that they are doing. Social workers and therapists have a toll taken on them when they're constantly dealing with hard situations. The amount of work and tasks that are given to social workers specifically can be strenuous. With the amount of work that is given on top of the emotional toll that this sort of job can take on somebody, this work is known for losing people throughout the field because of how burned out these employees can become, which then leaves them short-staffed, which means they have to make up the work, and it becomes an ongoing cycle of that burnout. Seeing these situations happen firsthand can become very exhausting. Situations like, for example, when I interviewed Danielle Frederick for my interview, she was explaining that she sees a lot of neglect within children and even a lot of abuse within children. Situations like that are hard to see, witness, deal with, and taking them away from the family that they're in, while it might be easy, it's also hard and emotional for both parties. And therefore it can become emotionally exhausting, especially when you're dealing with multiple different cases at once. Becoming numb to this work is also very normal. But at the same time, putting that emotion into the job is very important for the clients themselves. One thing that is very common within social workers and therapists is the secondary traumatic stress. Secondary traumatic stress derives from the indirect exposure of a family member, friends, or professional caregivers to traumatizing experience of a significant other or a client. So basically, secondary traumatic stress derives from somebody witnessing a traumatic experience, helping somebody deal with that traumatic experience, and that not being able to leave their mind. They'll see that and replay it in their mind over and over again. Studies find that things like self-care, sense of resilience, perceived social support, and salary are negatively associated with secondary traumatic stress, whereas things like caseload and anxiety were positively associated with secondary traumatic stress. So for social workers, this comes from experiences that they've seen or shared with their clients, and they will literally re-experience the traumatic events in their minds, which can affect their quality of life, it can affect their quality of work, and therefore affect their ability to continue to help their clients. Throughout the job of whether you're a social worker or a therapist, you're always advocating for your client or your patient. Specifically with social workers, they are going to be the voices that the clients don't have. So the clients will often look to the social workers to be their voice because they've been neglected and not taught how to use their voices, and so therefore they feel like they don't have one. With this, I personally think that social workers, although sometimes have no choice but to take on higher workloads, I think it's better for both the social workers and for the clients if those social workers could only focus on those certain caseloads or cases at once, meaning that they will therefore give a better experience to themselves and to the clients because they'll be able to focus more on them and the emotional turmoil that comes with these jobs will be lessened. The demands of these jobs can become very personal. It bleeds into their personal lives. So whether that be an emotional thing or with time, like they'll sometimes have no choice but to continue to be with these people. And anybody with a sense of humanity wouldn't just up and leave because they're off the clock. And therefore, I think that, giving them less of a caseload is even more relevant to these things. I'm going to end this with the positive note of social workers and therapists. At the end of the day, yes, the caseload should be shortened, they should be lessened, therefore allowing these workers to put more focus and energy into their clients and patients. But at the end of the day, once these cases are come together and they end, they know that these children that have been neglected are now put into safe homes, and they have somewhere where they can find their voice. Being somebody, as a therapist, once they allow their patient to graduate, they know that they've seen this patient struggle and go through whatever it is that they may be going through, and to get to a point where they can graduate is beautiful. It's beautiful to see somebody come from a negative place and bring themselves into a positive place. So I think that as much as social workers and therapists do deal with a lot, and there's a lot of changes that could be made regarding their emotional stress, at the end of the day, they do also have positive sides and definitely a sense of accomplishment.